moving now to Colombia, Venezuela. And as most all of you know, we have an enormous crisis in political making in Venezuela, and close to 1 million Venezuelans have fled the country and crossed over the border into Colombia. A lot of them women, a lot of them pregnant women. I mean, it's really an enormous crisis, and Americares is in the middle of it with our clinics, and we have two terrific speakers to talk about it. Moira Knight, who's Vice President of Communications, Astellas US, and President of the Astellas Global Health Foundation. And Astellas is a pharmaceutical partner of Americares for close to a decade, supporting our programs and emergency work. And they were one of our first partners to support our efforts and work in Colombia. So let me have Moira come up. And Walter James is our country director for Colombia for Americares. Walter. So let me start with Moira. Moira, you've been at this for a while and have had a relationship with Americares going back. So why don't you just give us a little bit of background of how you came to work with Americares and some of the kinds of things that you've been doing?
Sure. Good morning, everybody. How is everybody doing? Good, good, terrific. So I'm so pleased to be here. We started at Astellas working with Americares in 2010, but my experience with Americares actually goes back to about 2007. Shripad, I was working at Baxter International at the time with Alice Campbell, and remember when she and the team provided that initial funding, and it's just so exciting to hear what has happened there. I've been fortunate that my career has been a combination of communications and CSR and funding and giving, and I've had a lot of wonderful mentors. When we had the opportunity at Baxter to really start working with Americares in a meaningful way, it was, it's going to sound dramatic, but it was life-changing to me. I had an opportunity to go to El Salvador as part of one of the mission trips, and it was such an eye-opener and profoundly connected me to how a partner can actually help Americares do what it needs to do, which is such important and valuable work. So I know a lot of folks here are on the front lines doing that every day, and if you're ever having a bad day, give a call, because I'll be your biggest cheerleader.
So how did you end up choosing to get involved with Americares in the Colombia-Venezuela issue?
So last October, I had the opportunity to visit Astellas' office in Colombia. Astellas is a company just outside of Chicago, and we make therapies in cancer care and in immunology, regenerative medicine, transplant medicines and medications. So there's a real tie to helping people all around the world. I had this wonderful opportunity to visit with our very, very new office in Bogota in October, and my colleague and I, we were walking across a street. There was like a pedestrian bridge that went over this huge highway right next to our building where our offices are. And we saw a gentleman walking toward us. He had a cardboard sign, and in Spanish it said, "I am Venezuelan, help me." And my colleague and I were talking about that because we'd just been in a meeting discussing what kind of things could we do in Colombia that would be supportive of Venezuela. And then that very same day, we had an opportunity to meet with the ambassador, the U.S. ambassador to Colombia, Kevin Whitaker. He had a private event at his home, as a matter of fact, in Bogota. And he talked with us, you know, in his kind of living room, a really small space, about his #1 concern being healthcare as the Venezuelan crisis was building. He had seen at that time, this was in October, 2 million people come across, and I think we've now got about 3, if I recall, 3 million people Colombia is a country that will not turn anyone away, which is wonderful, but he spoke openly about vaccines, children and babies, elder care. And it was a profound moment for me because in the morning I'd had this experience walking across the bridge, and in the evening we're talking with the ambassador and seeing how it is an issue across the spectrum. When I came back to my office in Chicago the next couple days later, there was an email from Emanuela talking about what they were thinking about doing in Colombia and the work that was happening there. And that's when I knew that we had to do something, had to take action.
So we now have, Americares has 4 medical clinics at the border, largely serving, as we said, a lot of women, pregnant women. Walter, do you want to talk to us a little bit about what's going on? We had an opportunity at the board to see pictures of what was going on and the people lined up from 5 a.m. in the morning to go to the clinic. So give us a little bit of a sense of what's happening on the ground and what Americares is doing.
Thanks, Steve. Buenos dias. Good morning, everybody. So, yeah, as Steve said, we're currently operating 4 clinics for Venezuelan migrants and refugees in Colombia. This week, we should pass around 60,000 consultations since last July, so that's excellent. We have a dedicated team of Colombian doctors, nurses, psychologists. We're all passionate about humanitarian work there at our clinics, providing quality of care. And importantly, what we're trying to do, again, is partner with the Colombian Ministry of Health, partner with local health authorities to provide that care. Our clinics, we target areas in Colombia that often lack resources, and therefore the Venezuelan migrant population that comes there seeking health care often puts a bit of stress on the local healthcare system. So partnered with the Ministry of Health, we try to identify areas that would benefit the most from Americares intervention.
So one of the things I was struck by was the long lines that we had outside of the clinic versus some others, and why this was our clinics, or the Americares clinics, are essentially some of the preferred outpost places where the women are going. Talk a little bit about how the difference in terms of how you're approaching the clinics and the operation.
There's several reasons why we have such long lines. Partly is because the variety of basic medicines that we provide is, I'd say, there's a better variety than compared to other clinics. We also provide mental health consultations because we recognize that the socioeconomic status and the unstable nature of being a migrant or a refugee in Colombia can place a lot of stress on Venezuelans' mental well-being. And it's also just because we have longer hours. We have a very dedicated staff that is dedicated to seeing as many patients as they can during the day, even if it does mean staying a little later. So
great.
Yeah.
Moira, how do you think about a successful, we talked a little bit in the earlier session, a successful relationship, why you've come back to Americares? What do you think differentiates a successful versus an unsuccessful relationship?
Sure. I think, I'm an evangelist for Americares, so that maybe had something to do with it. But for me as a funder, one of the most important things that we can do, and it's going to sound very similar to what the both of you said earlier, is have those open lines of communication and really seek to understand the mission of the organization and the work that is trying to be achieved. One of the things that I talk about a lot as a funder is being agile and being flexible. The groups that we work with have to do that in the field every day. A problem comes up, they've got to pivot and change and do something that addresses that need. And we need to be able to do that as funders as well. Now, yes, you want to make sure you've got metrics and you want to make sure that the operation is sound and the work is happening, but there has to be some give and take in that relationship, a true relationship. One of the philosophies that we really try to apply is it's not just the monthly or the quarterly update meeting, it's seeking to understand the goal and where we can help with that goal. There are people in our organization who are so passionate about this work. I've also found that bringing in more people from our organization is very inspiring and intrinsically motivating for people. And that helps build more relationships that continue down the road as well. So it's definitely about the communication, but it's also being sincere about being flexible.
Great. Walter, you want to just talk a little bit about some of the things you're seeing on the ground right now? Where do you see this going in terms of the stories that you're hearing and, from the personal side of it and what we're doing?
As you mentioned, I mean, about 60 to 70% of our patients are women. 20% of our patients are pregnant women. Again, in Venezuela, there is quite a gap in terms of antenatal care for pregnant women. So you have some of these pregnant women traveling for 6 to 8 hours by road to come to our clinic. Sometimes the cost of transportation is as much as like a third of a month's salary to get something as simple as a primary health consultation. Since we found that so many of our patients are pregnant women, we are looking at, what are we looking at doing? We're looking at expanding our services package. Also, the Ministry of Health has asked us to intervene in 6 more areas of Colombia that are being impacted by the migrant crisis. Yeah, and again, we want to focus on like what our patient needs are, and that's antenatal care and things like health promotion. So educating young mothers on breastfeeding techniques, on how best to care for their infants, and also working on providing some of those sexual reproductive health services to women. Because again, we want the next generation of Venezuelans to be born healthy and born to healthy and happy mothers.
Great.
So.
Okay, why don't we take a couple questions from the audience? What do we have? Yeah, go ahead.
What happens over the next year or 2 years with the population you're serving? I mean, what do you think about in terms of scale? What are the next set of challenges?
Again, the challenge is, again, providing continuous primary care to best serve the Venezuelan migrant refugee population. We don't know what's going to happen in Venezuela politically. But regardless, I think that there will be a continued need. Because, and again, it's in terms of like maintaining a healthy population, primary care is continuous primary care is extremely important. And then we see that especially with the pregnant women. They come in for their antenatal care visit, 4 times. They go deliver in an emergency room. They come back with their baby, and it's providing that continuous care that will help us regardless of the situation in Venezuela.
Yeah. All right, another, yeah, in the back. Yeah. Oh, I'm sorry, Mike.
Hey, Walter, for the partners that are here, is there more that we can be doing to help you, just given how serious the crisis seems to be, and to your point, it's really unknown what the future will bring. So is there more we can do to help you?
Right. I mean, and thank you, Moira, for the generous donation from Astellas. But I mean, for example, with the donation that Astellas made to our program, what have we been able to do? We've been able to, rehabilitate clinic spaces. We've been able to provide medicines. We've been able to provide care 6 days a week at our clinics. And then because of donations such as that, we were able to think about expanding. We're able to forge those necessary relationships with local health authorities. So this is why the support is so crucial. And again, primary health is not something that's one and done. This primary health is something that's continuous.
Great.
And if I could just add to your question about scale, when we were talking with other public policy folks in Colombia, they were talking about at least 1 million people a year, if not more, and the primary concern being vaccination as the number one, followed by everything else, but that was the number one.
Terrific. Well, thank you guys.